Morning, everyone, and welcome to Cares County Family Services live stream. I'm your host, Jordan Kreiderman. I'm part of the Communications Department at CSFS. Today, I'm located on the beautiful unceded territory of the Lheidli, and I invite you to reflect on the land that you are presently on and the gratitude we share for the lands that sustain us all. As we all know, navigating the healthcare system can be confusing at the best of times. And so today we're joined by Dr. Montana Halliday, who has offered to help us access the services we need in our communities. Dr. Montana is a CSFS physician serving the Stilatin First Nation. She also works at Central Interior Native Health in Prince George and also works in the ER at the hospital in Prince George. I'm also delighted to share that Dr. Montana recently welcomed a healthy baby girl into the world, and they also got a new puppy. So welcome, Dr. Montana.
Thanks so much, Jordan. Tabema Hadi Susie Montana Halliday. I am a family doctor, as Jordan said, that serves Karisakani and specifically Stilatin First Nation. And I have a dream that our Karisakani patients will be the most empowered patients in all of BC one day. So I'm hoping to do these education sessions frequently until this confusing thing we call the healthcare system seems a little bit more user-friendly. So I'd like to start with, of course, why isn't this flipping?
Just before we get started, we will be taking questions. We would love to hear any questions that you have. And so if you have any, just drop them in the live chat. And we'll hold them on until the end. And then once the end of the presentation, Dr. Halliday would be delighted to answer your questions. And if you have any questions after the live stream, or maybe you're seeing like the uploaded video of this after the live stream, and if you have any questions, just send them over to communications@csfs.org. I'll drop that in the chat as well, just so you know. And so take it away, Dr. Montana.
Thanks, Jordan. Yeah, I'd be happy to answer any of your guys' questions in email afterwards as well. So I'm just gonna start with the picture of my child, of course. So this is Talia, and she was the inspiration for this presentation, her and my patients of Karisakani. So at 2 months old, she's 6 months now, she started to develop seizure-like activity. And I went to the emergency department where I work, in the hospital where I work, and I felt totally scared and not empowered and confused. And I just couldn't help but think how it must feel going into the hospital when you're not in a position of, privilege like me, where I am a physician that works there. So it wasn't until somebody recognized who I was that I felt like I got safe, sensitive care, and where things were better explained to me. And so I wanted to make this presentation so that we can all benefit from the knowledge that I have about how the healthcare system works, so that when you're faced with those scary situations, when you're feeling unwell, at least you know what should be happening, what your next steps are. And so hopefully then you can feel more empowered and more safe in the healthcare system. So the healthcare system is complicated. It is a maze, and it's very difficult to navigate. Even if you do work in it, it can still be challenging. For instance, my daughter's test results were lost, and if I hadn't known where they had been sent to and what phone number to call to get them, I never would have got them. So unfortunately, people fall through the cracks all the time in the healthcare system. And the reason why is because each doctor is responsible for about 1,000 patients. And so when one doctor is responsible for 1,000 patients, that means that the doctor needs to ask many other people to help them with different things like sending faxes, sending prescriptions, setting up tests to be done, setting up blood work. And every time we ask for help from other people and we work with other specialists or pharmacists or nurses, there's a request to fall through the cracks and for it to not be completed. And so what I want you to learn today is how things normally work, so that you know where to call if you think that things aren't going through the way that they should. So I texted Cynthia Munger, you may know her, she's the CHR in Slatin, and I asked her for a picture that to her represented Indigenous empowerment. And these are the pictures that she sent back to me, and I thought that they were perfect. So Slatin's, I'm sure many of the communities that Carriers County serves, but I'll speak specifically to Slatin because I spent the most time there. They are very good at creating their own food security. So they, go hunting, they go fishing, they have a community garden, they know what they need to do in order to, preserve the food for the winter. And so they have security in their food. To me, I have no security in my food. If there's no food at the grocery store, I'm not eating. But I feel more security in the healthcare system because I understand it and I know how it works. And so what I'm hoping is that I can educate to the level where you feel confident knowing what is to be expected and what should be happening so that you can identify when something isn't happening the way it is and get the help that you need so that you can feel empowered in the healthcare system just as Slatin feels their food security. So your sent out that will be sent out that has all of this in bulletproof form. You can put it, you can keep it on your phone, hospital with you or the clinic. But the first question you need to ask yourself whenever you're feeling unwell is, do you need a solution? Well, it says my internet's unstable. Can you still hear me okay?
Yeah, I can hear you. Cut out just a little bit. And I think you were just mentioning that the handout that we'll have available. We'll have it up on our website along with the recorded version of this presentation as well. And we will be sure to include the link on our Facebook as well, so it's easy to find for everybody.
Perfect.
But I think your internet's back.
Okay, perfect. So yeah, if you could have that handout on your fridge or have it on your phone so that when you go to the hospital or you go to the clinic, you can have it easy. So the first question you need to ask yourself when you're feeling unwell is, do you need a solution within 24 hours? Not, do you need to see a doctor within 24 hours? Do you need a solution to your problem within 24 hours? Because you might be able to see, let's say you break your foot. You might be able to see me on the phone within 24 hours, but by the time I ask for the x-ray department gets my fax for the x-ray and they book you in for an x-ray, it's going to be, a day or two. And then by the time I get those results back from your x-ray that says your foot's broken, that's going to be another day. And then by the time I can talk to you again and get you set up with a cast is going to be another day. So if you need a solution to your problem within 24 hours, then I would recommend that you go to the emergency department. If your problem can wait 24 hours, the solution to your problem can wait 24 hours, then definitely call your doctor's office and book an appointment. Usually first thing in the morning is the best because that's when the most important appointment spots are available. So I'm going to talk about both the ER and the clinic and how each of those systems work and sort of some tips for each of them. So in the ER, basically what the ER physician that you see is going to do is they're going to either say you're too sick to go home and they're going to admit you to the hospital, either under another family doctor, a specialist, or a surgeon, depending on what your concern is, or they're going to say they think you're healthy enough to go home and they're going to send you home, either with a follow-up plan with me or your family doctor, or they'll order some tests to be done at some point within a couple weeks or so, and then to follow up with your family doctor afterwards. So that's what the ER physician is deciding. Are you too sick to go home? Are you healthy enough to go home? And so here are my tips for the ER. Number one, if you don't agree with the ER physician and you don't feel safe going home, then just say, I don't feel safe going home. And that can be for any reason. It can be because you think you're too sick to go home, but it can also be because you don't have anybody at home that can watch out for you if things get worse, or you don't have a home to go to, or any reason, or your home is very, very far away. And so if things were to get bad, it would be very hard for you to come back. All of these reasons can be a reason that the ER physician didn't know initially to not send you home. So if you disagree with the ER physician, and you can just say, I'm sorry, I don't feel safe going home. And what the ER physician will do is they'll either come up with a plan to make you feel safe. Maybe they'll get you a hotel by the hospital. Maybe they'll call your family member and explain. Maybe they'll, there's been lots of times where a patient has said, well, could it be this to me? And I hadn't really thought about it. You know your health the best, you know your family history the best. And there's been lots of times that patients have said to me, well, my mom died of a heart attack at a very young age, and I'm scared I'm having a heart attack. And that will make me think harder about if this could be a heart attack or not. The other tip, so that's my biggest tip. I don't feel safe going home if you don't feel safe going home. My next tip is, unfortunately, the technology in the healthcare system is very far behind. So my Facebook is way more technologically advanced than the healthcare system's technology. So I do not know if my patient has gone to the ER unless my patient asks the ER to tell me, or if they call my receptionist, the medical office assistant, and tell me. There's not an automatic notification that says you were in the ER and this is what happened. And I don't get that information unless you request it. So if you could please, when you go to the ER, say, hey, Dr. Montana or Dr. John or Dr. Terry is my doctor that I'm here, then we will get all of the paperwork from the ER and we'll know what happens. My other tip is to have 2 sets of ears. When people are sick, they're not hearing well. Also, when people are in the hospital, doctors have a tendency to use medical jargon that makes no sense. And they have a tendency to talk fast, such as myself. And they have a tendency to ramble off a bunch of, it's almost impossible to remember them all. So if you have 2 sets of ears, that really helps. So if you can bring a family member or friend, they can listen, they're feeling well, they can tell you what the follow-up plan is. COVID, the rules change all the time. Last email I got, we were allowed to have visitors. I think that just changed recently. So if you're not allowed to have someone accompany you into the ER, you can have them on your phone. You can have them on, there's Wi-Fi at the hospital. You can have them on Facebook Messenger chat. You can have them on WhatsApp, have them on Signal, any of those. You can also ask the ER doctor to please call your significant person and explain to them the plan. And that's totally reasonable to ask them to do that. And I think a good idea. It's really important before you leave the ER that you know what the follow-up plan is. And I have this detailed in the help. So you need to know, when are you seeing a doctor again? So are you expected to see, and who are you seeing again? And are they going to call you, or are you going to call them for an appointment? You need to know where your medication is being sent. You need to know what tests are being done, and are they going to call you, or are you going to call them to get your tests done? And the last thing you need to know is, when do you need to come back to the ER? What symptoms, what circumstances should you not wait to see your family doctor? Should you just come straight back to the ER? Because things change all the time, and doctors aren't God, and they're not magic, and we don't know 100% what's wrong with you all the time. We have statistics, we have most likely scenarios, but we always like to plan for what if we miss something, and in what situation should you come back. So those are my tips for going to the hospital. Now, the more complicated one, to talk about the clinic. So if you need a solution to your problem more than 20, and you can wait more than 24 hours, this is called an outpatient situation, or outside of the hospital or in the clinic. And there's way more cracks to fall through, simply because we're not all in the same building. There's not a bunch of specialists and x-ray and blood work all in the same building. So that makes, when we're coordinating with many different buildings in different areas, that makes more room for things to fall through the cracks. So it's really important that you understand how the system works. So the medical office assistant is your best friend. They are the middleman between everything. So if ever anything is going wrong, the medical office assistant is the person who should be able to know what went wrong and how to correct it. So when you call the office to book an appointment, you talk to the medical office assistant, and they book you an appointment with the doctor. And then the doctor does your assesses you and comes up with what they think is wrong with you. And then they send off medical referrals to see a specialist, referrals to see a nurse, referrals to see a counselor or social worker. I'm just going to pause for a second. Okay, I'm going to keep going.
Yeah, I think you're good now.
The medical office, the medical office assistant sends off the requisition to ask for blood work, the requisition to ask for x-rays and imaging, and your prescriptions. So as you can see, the medical office assistant is the middleman for everything. Once all those results come back, you've seen the specialist, you've seen the counselor, you've got your blood work done, you've done your x-ray, you've taken your medication, then family doctor gets those results and asks the medical office assistant to put you back with them. The reason the doctor can't do all of these things themselves is because they've got those 1,000 patients they need to deal with. So we ask for help from other people and to get all those things done. And so doctors actually I don't actually have the capability to fax anything, to send off anything. I always ask my medical office assistant to help me with that. And so that brings me to my tips. Oh, and what I mean by we can't fax it is our user doesn't allow for them to fax it. I'm sure we could figure out how to do it, but for some reason it's old like that and we can't. So here's my tips. So my number one tip is know who your medical office assistant is, as everything goes through them and the doctors don't have the capability on our system to fax things. And the number one error that happens is that the fax didn't go through. Don't ask me why we still use fax machines. It's archaic, I know. I'm sure it's going to change in the future. But the number one error that I see is that the fax didn't go through. The lab didn't get the requisition. The x-ray didn't get the requisition. The pharmacist didn't get the prescription. The specialist didn't get the referral. So if you haven't heard back from all of these different places, your first step is to call the medical office assistant and see if the fax went through. If it didn't go through, they can resend it. The number two most common error is that all these different places tried to call you, but they couldn't reach you. And so it's really important that you speak with the medical office assistant and make sure that your phone number is up to date on your chart. Because every time I send off a form that says, please do an x-ray on Mary, I have Mary's number that I last knew. So if this changes, it's really important for you to let us know. Otherwise, x-ray will never be able to call Mary to bring her in for her x-ray. The other thing is to try and answer your phone. I know we get lots of annoying calls from people that are wasting our time, but there are some common numbers to remember. So for instance, 565, that's the Prince George Hospital. So if you ever see 565 on your phone, that's important to answer because that would be specialists or imaging. If you don't want to answer your phone, that's fine. Just make sure you check your voicemail because all of these different places need to leave a voicemail if they are going to say that they weren't able to get through to you. Make sure that you write down your appointment times, especially for specialists. If you miss an appointment with a specialist, you go back to the bottom of their queue. So they take all the referrals in, all of the different letters from doctors asking to see their patients. They prioritize patients with high risk problems like cancer who need to see them right away. And then they prioritize people based on how unwell they are. If they book you and they don't see you, then you go to the bottom of the pile. And so then you have to wait months again. So it's really important that you write down those appointments with specialists. And if you're going to miss them, just call them a couple days in advance and they're way more understanding that way. My other tip is to have 2 sets of ears. As you can see on that list, there's so many different things we can be asking you to do. We can be asking you to see the nurse for a vaccination, see the specialist heart, to get blood work done, to get an x-ray done, to pick up your medication, to see a counselor, to talk about your mental health, to see a social worker to help you with disability. All of those things, it's impossible for you to remember them all. I have to write it all down so I can remember it for you. So I really suggest that you have 2 sets of ears as well in these appointments so that nothing is missed. Prescription refills, I just have a couple more slides. So usually we give people 3 months at a time. And there's a reason why we do this. It's not because we can't just write 5 years. I could say, give this person 5 years of blood pressure pills, but I know that there's cracks that people can fall through in the healthcare system. And so what I do is I only give you 3 months because I want to see you again. If I don't see you again, I'm not prompted to look into your chart, see if your blood work is up to date, see how you're doing. So I only give 3 months so that you come back and I can check your blood pressure, check in how you're doing, see if you got your x-ray done. The pharmacy, since COVID, it only dispenses 1 month at a time. So I'll say give 3 months and they'll give you 1 month, but you don't need to see me again to get the other 2 months. They'll just release it one at a time. If you lose 3 months of medication, the government doesn't cover replacing that. That's why they only give 1 month at a time. So if you lose a month, then the next month will be covered by the government, so on. You can tell if you need to see the doctor again by looking on your bottle. If it says refill 0, that means that the medication in your bottle is the last medication you have. And so you should book an appointment with your doctor to get a refill. If it says that there's refills, that means that you have the medication in your bottle and repeat fills without having to see your doctor. So all this is to say that I think it's best to not text and just ask for a refill, because if you do that, then you risk prompting the doctor to look into your chart, to look at your blood work, to see how you're doing, to see if you're having any side effects, to make sure the dose is right for you. It's better to actually be able to see your doctor so we can make sure everything's going well in your health and that nothing is falling through the cracks. Last thing I'll talk about is blood work. So when I wake up in the morning, I've got about 300 results in my mailbox, blood work results to go through. So I check off one. I ask my medical office assistant to book an appointment to follow up those. But if the blood work got lost somewhere and it never came through my mailbox, then I might not get it. And it might be abnormal. It didn't come to my mailbox. And I wish I could say that never happens, but it does sometimes, which is why I have that 3-month rule, so that if anything was abnormal at your blood work, I would be able to see it when you come in for your refill. I would look back and say, oh, I never got notified that this blood test was abnormal. Let's deal with it now. So normally I only call people for abnormal results, but if there's something you're worried about, I'm totally fine with you booking an appointment to discuss your normal blood work. That's totally, totally fine. My biggest pet peeve probably right now is that you have to book an appointment to get your blood work done with the lab, which I think is a very unnecessary barrier since COVID. You can't just drop in very well anymore. The only lab, life labs. So if you see this link here, if you click that, then you can schedule in your own appointment or hold your place in line for drop-in blood work at any Life Labs location. So there's one in Prince George on Victoria Street, and there's one, I think, in Burns Lake. If you want to get your blood work done there, just ask your medical office assistant to send it there. COVID testing, you don't need a test. You should still see your doctor if you're feeling really unwell, but if you're sort of just having mild symptoms and you just want a test, you can book it there. I lied. This is the last thing I'm going to say. So this is the last thing I'm going to say. So when a patient comes to see me, let's say they come with a cough, what I'm thinking is I'm ruling out anything life-threatening right now that's causing their cough, making sure that they aren't going to pass away or become very unwell very fast. And then I'm going with what I think is the most likely cause of their cough based on what they're telling me. But if they're not getting better, I really want them to come back, because there's probably 100 different causes for a cough, and I've only ruled out the most likely and gone with the most likely. So I need you to keep coming back if you're not feeling well. It's not annoying if you keep coming back if you're not feeling well. Every time a patient comes back saying, hey, that didn't work, then I've got to think a little bit harder. I've got to ask other people for their opinion. I got to talk to specialists, and that's fine. That's my job. I need to do that. If I don't see you, I'm assuming you're doing better. So please come back if you're not feeling better. And that's it. Today, MC. Happy to take any questions.
Excellent. Thank you so much, Dr. Montana. There aren't a whole lot of questions. There was a comment about a certain individual experiencing some side effects with the COVID vaccine, and so maybe the way we can answer that is what should someone do if they're experiencing? I know side effects are very rare with the vaccine, but if someone is experiencing any side effects, what should they do?
So if they're experiencing side effects, they should book an appointment with their doctor to talk about them. If it's just within the first 24, 48 hours with the vaccine, it's probably going to get better if it's something mild like a fever or sore arm. But if it's something more severe than that, then they should book an appointment with their family doctor to discuss it so that we can go through, make sure that it's not side effects from the vaccine.
Excellent. Thank you very much. Someone's asking if we can email the PowerPoint presentation to the communities. I do have a copy of it, correct? Would you be okay if we uploaded it along with the handout as well?
Yes.
Okay, excellent. So we will have the PowerPoint available on our website as well, and we will be sharing a link later today with all that information. I have a question. What are some examples of maybe needing a solution within 24 hours? Someone like myself, I don't know maybe like how severe something could be. So like, for example, I thought I broke my collarbone and I was like, oh, do I need to go to the like emergency now? So yeah, like, what do you think?
Those are good questions. So I think probably there's two answers to that. One, if your symptoms are so severe that you are too uncomfortable and you need at least pain control, then it doesn't matter what's causing it. You should go to the ER. Wait, let me just think about that. I'm thinking after hours. So if it's after hours and you're really, really uncomfortable and you're not going to be able to make it through the night, then you should for sure go to the ER, whether that's abdominal pain or a broken something or a bruise something, anything that's really bad symptoms that you are too uncomfortable to sleep and it's after hours, you should go to the ER. Some other examples would be things like broken bones. Usually if a bone is broken and it is not aligned properly, we need to make it aligned and cast it. So I think going to the ER to get the x-ray to make that assessment is not fainting are very serious. Things like not being able to breathe are very serious. Things like severe abdominal pain, severe anything would be a reason to go in. Something that's kind of comes and goes. The thing that I reassure myself with is, you know, if I have 1 second of chest pain, probably not a heart attack if it just hurt for 1 second. But if I have severe chest pain or severe abdominal pain that's not going away, then obviously something significant is going on that I should get checked out about. Does that kind of help a little bit?
Yeah, definitely. Yeah, absolutely. And another question that I actually thought of during your presentation is if I need a prescription refill, should I always see my doctor, or like, is it okay if I go to the walk-in or what have you?
Yeah, so it's probably best to see someone in, like, if you need a prescription refill and you only take one medication and you're fairly healthy, then it's totally fine to go to the walk-in, but they won't have any of your records because our systems don't talk to each other. So the walk-in doctor's records don't talk to the ER's records, don't talk to my records. So I would prefer that my patients come to one of the carrier Sakani patients, carrier Sakani physicians, so that I can see what happened in the chart and they can see what I was planning, what I was concerned about with this patient, and they can read my notes and fill in the blanks there. So I think probably it's best to see, if you're a carrier Sakani patient, to see a carrier Sakani physician, but if you can't get in, then you have to go to the walk-in. But if you want total holistic thinking, more than just refilling a medication, thinking about you as a whole person, probably seeing your family doctor is best.
Okay, excellent. And we did have one comment come in here. I think maybe this might be referring back to the COVID vaccine. They're saying, what if you have dry, itchy skin and suffering anxiety at the same time? Maybe that's not referring to the COVID vaccine per se, but yeah, maybe how dire is that situation, I suppose.
I think dry, itchy skin, I can't think of anything that would kill you in 24 hours from dry, itchy skin. So I think that, or from really bad anxiety. So I think seeing your family doctor within a day or two or a week would be totally fine.
Okay, excellent. Oh, uh, okay, so we just got a comment. It's just saying, if someone sorry, if someone has a feeling they might be getting sick but are leery of seeing a doctor because they might get tested, the anxiety of the test gets to them.
Mm. So that's actually a really good point, and I'm going to write down to include that in my future presentations about this. So something that patients don't realize is that you are the boss. So I can recommend that you do 100 different things and you can do none of them. And I cannot force you to do them, and I cannot get mad at you if you don't do them. My only job, I describe myself as a mechanic. So you function optimally and make sure that we catch things long in advance and make sure that nothing is possibly going wrong, but you can decide whether or not you want to do any of the things I say. So I can say, I think you should get a COVID test because of X, Y, and Z, and you can that's going to cause me too much. I'll just self-isolate and I can say you should take this I think you should take this medication. You can say, I don't really want to take medication. And I can say, that's totally fine. So it as long as you understand what I'm worried about and why I'm recommending something, and then why you're saying, no, that doesn't work for me, then that's totally fine. I'm not God, and I can't force anybody to do anything. And the first thing I learned in medical school is that 50% of what we tell patients to do, they don't do. So I don't take it personally at all. So if you want to talk to a doctor about your symptoms, but you don't want a COVID test, they won't get mad at you. They won't, you're the boss. That's fine. You can still talk about your symptoms.
Okay, yeah, that totally makes sense, and I think even puts me at ease. So I think that's all the questions we have for today. Again, if you have any after the presentation, or you're seeing this, like the uploaded version of this presentation, and you have questions, feel free to send us an email at communications@csfs.org. Yeah, if do you have anything else that you want to mention, Dr. Montana?
No, that was really great. Yeah, thank you so much. I hope it's helpful. I would love if I just made this up in my head that it's going to be helpful, because I'd like the presentation to get better and better, and I'd like people to become more and more empowered. So any
Well, sorry, I think you cut out there just a little bit.
just I would like if people could give me feedback, that would be very helpful, because I don't want to do this if it's not helpful, but I do want to do it if it is, and I want to make it better and better so that patients can feel more and more empowered. So is that to say, you must be a carrier Sakani patient. You know exactly what's going on.
Exactly. Yeah. And again, if you have even feedback for the presentation as well, feel free to send us that email as well, and we'll make sure to pass it on. Okay. Well, thank you very much, Dr. Montana, for joining us today. It was very, very helpful and very informative presentation, and we hope to see you again soon.
Thanks, Jordan. Really appreciate it.
Okay. And thank you, everybody, for joining today. Have a great day.
Bye-bye.